Welcome back to Black News Tonight. The opioid crisis, once seen as mostly affecting white Americans, has been increasingly impacting people of color, especially black men who are losing their lives at an alarming rate. A new study published in the Journal of American Medical Association Network Open revealed astonishing results. When examining the opioid fatality rate for adults older than 55 years old, it found that while non-black, Hispanic, American Indian, and white men die at a rate of 12.8 per 100,000, the rate of opioid deaths for black men is 40 per 100,000 people. That means older black men are dying from opioid overdoses at rates nearly 4 times higher than men their age. Discussing this more is Dr. Ayana Jordan. She's an addiction physician and associate professor of the Department of Psychiatry at New York University. Dr. Jordan, thank you so much for joining me. Help me understand this issue because it is stunning how older black men are dying at these rates. What are the factors behind the increase in opioid deaths among older black men?
Yeah, let me just first start off by saying thank you for covering this. This needs to be on the mainstream media everywhere. But I am so appreciative to Black News Tonight and you, Mark, for really covering it with the tenacity that it deserves. The bottom line is, yes, this study came out, on January 11th, but the rate of opioid overdose deaths have been increasing amongst Black people and Black men since at least 2013. And so we didn't just get here overnight. And I think the better kind of like a focus issue is why? What is accounting for this increase, this rise? And why have we ignored this for so long with just focusing on white people? And so, unfortunately, for those of us who have been studying this, we've seen the trends and it continues to go up. And if we don't do something in this country to really focus on Black people and Black men in particular, the rates of deaths will continue to go up.
It's interesting because as the rate of death is going up, there's a way that the problem itself has been racialized, but racialized white. That is to say, if I say there's a crack problem, nobody's thinking about white people in Kensington and Philadelphia, right? When I say that, there is a powder cocaine problem, people are looking, at Miami Beach or some lawyer's office. But when I say opioid, people are thinking that this is something that does not affect the Black community. Why is that assumption the case and why is it wrong?
Yeah, part of what is happening is the messaging. Like you were saying, we have racialized drugs in this country where crack is Black, powder cocaine is white, and opioids are white. And that is deliberate messaging from government agencies, from mainstream media that allow us to think about substance use in terms of color, what is all made up. And when I tell people as an addiction physician that white people are using cocaine at the same rate, sometimes even greater rates than Black people, they're shocked. Or I see just as many white patients that smoke crack as Black patients, they're shocked. So part of what we're seeing with this opioid crisis is that there has been a deliberate messaging and leaving Black people out of the picture. And so there are Black people that don't even realize that they in fact use opioids. And I want to give you an example because heroin is an opioid. And Black people have been using heroin at alarming rates since 1960s and 1970s, but nobody said, oh, we're having an opioid crisis there when predominantly Black neighborhoods were immensely affected. It only began to really think about opioids when we talked about prescription pills affecting white people, right? And when you have the face of those prescription pills as white, no one accounted for Black people who continue and have been using heroin, that is an opioid, but also discounting that we also can become addicted to prescription pills as well. So we have to really be thoughtful in the way that we message who is a part of this epidemic and who isn't. And I have made it my work and really one of my passions to say Black people are a part of this. The healthcare system needs to know that. People need to be alarmed about these disproportionate rates, because if we don't do something, we will continue to lose a huge portion of our elderly population. It's alarming for sure.
It's absolutely alarming. Now, there are some challenges that prevent Black people from getting the treatment that they need in terms of addiction. What are some of those things that make it harder to access the support, medical support that we need?
Yeah. Yeah. I mean, honestly, at the heart of the issue is racism. I'll just be very clear about that. Because a lot of people say, well, Black people don't have a trust in the system, and they are not going to care, et cetera, et cetera. But one of the things that's important to note is that even when Black people do engage in care, they are less likely, in the case of opioids, to be offered life-saving medication that actually prevents death from an opioid use disorder. So I just want to break that down, because a lot of people say, even physicians, they'll say, oh, Dr. Jordan, it's because Black people don't have insurance and they're not going to the doctor. And I always say, that's not the entire truth, because when the Pew Research Center did a study and saw, if you compare Black people with health insurance, to white people with health insurance, even when Black people go to the doctor, they're not offered life-saving treatment in the same way that white people are. And that was just really unsettling. And I tell people, to really go to the literature and look at that. So part of it is, one, why aren't Black people with opioid use disorders being offered this life-saving treatment? Why aren't they being treated the same as their white counterparts? And then two, when Black people go to the doctors, they're not even screened for having substance use disorders. And if they are screened for having substance use disorders, the specific disorder of having an opioid problem is less on the agenda, because people think of that as a white problem, right? And doctors are guilty of racializing the issue. So you can't be treated for something that you don't even know you have, right? And if you as a Black person are using, let's say, heroin, but everybody else is talking about prescription pills, you might not even understand that you are part of the opioid epidemic, right? So we have to really talk about the fact that everyone is being affected, but because we have been left out of the conversation for decades, now we are being disproportionately affected and dying, right? And so, oh my gosh, Marc, like, it just pains me. It's like Black men account for disproportionate increase of all opioid overdose deaths since 2013.
It's
That's
insane.
wild.
The numbers are, it's wild. The numbers are stunning. They're disappointing. And the sad part is, as long as it's Black people dying, the nation won't have the same kind of outrage, the same kind of indignation, the same type of urgency that it does when it's vulnerable white folk. But that's why we're going to keep putting a spotlight on this. That's why your work is so important. And that's why it's important for everybody to raise their voice on this critical issue. Dr. Jordan, thank you so much for joining me on Black News tonight.